people don't ask me very simple, pertinent questions about good oral health and simple tips and tricks on how they can take care of their teeth on a day-to-day basis. And yes, I do engage myself in what we call as pop dentistry or popular dentistry. Um, and I do go ahead and I'm just going to share a small little video with you as to what we do at the office or what I like to do or engage in. So we try and do bespoke customized files for people who would like to have a service like that.
Thank you so much, Dr. AJ, for starting the session. I had a little bit of technical difficulties joining in. Technology is not always on our side. So as the video is playing, I wanted to thank everyone that we have with us today and wish everyone a very Eid Mubarak and a blessed Eid for everyone celebrating. For today, of course, most of our attendees already know. I'm seeing a lot of familiar names from all across the Gulf. Most of you would be familiar that this session is the latest of MetLife's series of health and well-being webinars. My name is Ahmed Zaini, and I am head of disease prevention and well-being unit for MetLife in the Gulf. For today, we will be talking about one of the things that maybe can cause one of our biggest health problems, but is also one of the easiest things to avoid and prevent, which is our dental health. For dental health is essential for our overall health. Our good oral health would improve our ability to even express our emotions. It improves our ability to speak. It affects our ability to smile, to smell, to taste, to touch and chew and swallow, and to make facial expressions to show our feelings and emotions. And fortunately, like we said, it's the prevention for it, and taking good care of our teeth is very economical and is very responsive to preventive treatment. One of the things that we also want to cover today is that a healthy smile begins at childhood, hence the title of the session, The Eternal Journey of the Tooth. Starting early is critical to the success of preserving our healthy smile for a lifetime. And dental cavities, for everyone who from us who has kids would know that dental cavities are one of the most common childhood diseases. For today, just a quick housekeeping before we start. So the session is being recorded, and the recording will be shared with you after the session. You are muted, so you don't have to worry about any background noise. If you have any questions, please make sure that you put them in the chat box or the Q&A session. Just make sure that you address your questions to both panelists, or the panelist and the host, and not only to Dr. AJ, because he will not be able to see your questions as he's presenting. For everyone joining from a desktop, you will find the chat and Q&A on the bottom right-hand side of your screen. For everyone joining through the phone, you would see it at the bottom section of your screen. For today, I am very glad and very honored to have with us Dr. AJ Juneja, who joins us from a New York dental clinic in Dubai. Dr. AJ is a multi-award winner, and he currently serves as a country chairperson for the UAE for European Society of Cosmetic Dentistry, and is also the ambassador for the European Academy of Digital Dentistry in the UAE. Dr. AJ, we're so happy to have you with us today. Thank you so much for your time today for our session, and I will pass over to you.
Thank you, Ahmed, once again, and thank you, MetLife, for organizing this this webinar. And thank you also to OralBio for being a participant and a partner in this webinar. As you have briefly introduced me, and I don't need to say it again, very happy to represent the European Society of Cosmetic Dentistry and the European Academy of Digital Dentistry in the Middle East for the UAE as their country chairperson. I run a small little office in Jumeirah too, just opposite the Four Seasons, and it's called New York Dental Clinic. I was just mentioning that, whenever I go out and I meet people, most of them talk to me about the big stuff. People talk to me about, what is very trendy, and people talk to me about what has really become popular in dentistry. And people think dentistry is a Hollywood smile and having white teeth, and sometimes they even look like chiclets, which I don't like, but that's, to each his own. But nonetheless, the point is that we have always considered, pink looking gums to be healthy, and let's say white as a color, which is healthy. So if you have cavities or caries, they don't look white anymore. If there's a lot of staining and there's gum disease, they don't look so healthy anymore. And it gives you a sign or a projection that your mouth is not healthy and something's wrong. So in line with what we call as popular dentistry, I do uh, something of the same myself, which I've been trained to as a prosthodontist and as an aesthetic dentist, having two master's programs that I've done over the years. And at New York Clinic, we pride ourselves on providing a service of a similar kind, where we go into a lot of details to find and repair spots for our clients. So yes, indeed, I have been suggested, or I've been said to be somebody who is a smile designer in a way. But at the end of the day, I'm also a restorative dentist, which means I do day-to-day general dentistry as well, whereby it's not only about doing a Hollywood smile or giving somebody veneers or, a complete makeover. I do cavities, fillings, and I do what is called as everyday dentistry for problems that are real and that are more commonly seen than the other things that people talk about. When I always say, and when we think about smile makeovers, and before that, as a disclaimer, I would like to say, always think minimal. You're not, Hollywood smile doesn't mean that you need to spend an endless amount of money on your teeth. It all begins with good oral hygiene, with clean teeth, getting them cleaned at the dentist. And there are other options that you have. If you have crooked teeth, you don't necessarily have to get them shaved down to have veneers. You can always consider something like orthodontics or braces that I've had for my kids as well. You could even consider tooth bleaching, which is nothing but a peroxide that breaks down into water and oxygen that brightens up your teeth. And sometimes in the good hand, in a good pair of hands, you can even have some very minor corrections done by procedures like bonding. So don't always think that you need to go big. You need to have a lot of dentistry done to your mouth to make it look good and make it look nice. I never suggest that. It's very individual. Yes, in cases where it's a complete breakdown, I can rebuild a whole mouth like I'll show you. But then there are some very minimal things that can be done to keep teeth clean and make them last a lifetime. More importantly, more than a smile designer or what we call a general dentist or owning a practice, I am a very happy father of two kids. And these two kids mean a lot to me, as I'm sure yours do too. And what I'm always thinking about is what is going to be responsible from my side for these two kids to have their teeth for a lifetime. Healthy, nice, good gums, and good teeth for a lifetime. So I'm just going to share with you a little bit of that journey on a certain thing. And as I said, the title is The Journey of a Tooth, which means from when you're born to having baby teeth to then having adult teeth, and certain problems that we see in different aspects of life and different time of life, and how we can actually take care of them. So just to briefly introduce you to my office in Jumeirah, it's called the New York Dental Clinic. We built a small office with new specialists in So I started this journey with the New York Dental Clinic, which I, created about 3 years ago. And the whole idea of the office was to have providing exceptional dentistry, because all the people that I work with or who work with me at the office are opinion leaders. They are people who lecture worldwide in their specialties or fields. And we provide a multidisciplinary kind of an approach to dentistry where you are assured of an exceptional dentistry with a lot of compassion. That's what I truly believe in. When I look at modern day problems coming to our office and when we discuss them, these are the main problems that we actually see. We see a lot of clients with inadequate hygiene. We see them with, on a day-to-day basis, cavities as caries. We see a lot of gum recession happening today, as you can see on the left. And eventually, worn down teeth or exposed dentine or nerves can give sensitivity either on the root surface or on the surface of the tooth that you eat with, which is called a crown. A tooth, is present when we are children, and we call them as baby teeth or deciduous teeth. And then you have adult teeth, which come in after the age of about 6 and hopefully should last you a lifetime. There's a different journey that both these set of dentitions take place, and eventually they all serve a certain individual purpose as well. So we can never say, and this is one of the things that I always, have a discussion about with some parents, because when they come in or when I meet them socially, they would say, 4-year-old child or 3-year-old child or 2-year-old child having a lot of cavities, it's going to be fine. We know that these teeth are going to go. But what we don't realize is that under these milk teeth are where the permanent teeth are actually developing, which means that ill health of milk teeth can eventually lead to very bad permanent teeth. Sometimes, if they're prematurely removed and the bone closes over, the permanent teeth actually find it very hard to come through. So the milk teeth are providing a map on which the permanent teeth will travel and come out on, and their health is imperative to the health of the jaw, the growth of the jaw, and the health of the adult teeth. Essentially, the issues that we see in the dental office, or why we see these problems, as I've stated before, is A, to do with diet, second, to do with certain environmental factors, and third, to do with maintenance of oral hygiene. And I'm going to discuss a little bit of these three in detail. When it comes to diet, the thing that we find, and this is a myth that we don't discuss with a lot of people in detail, is that, are juices good and what kind of a juice is good? So most of the juices that come in with preservatives are not good because sugar is always added to it, and sugar is added in everything. You have a bottle of ketchup, you have sugar. There are hidden sugars everywhere, so you need to be aware of how much is the amount of sugar in a food, in some kind of food that you're consuming. Now, one of the things that people say is, oh, my kid's having orange juice for vitamin C. Is it freshly squeezed? Is it out of a bottle? Is sugar added or not added? Again, a lot of juices have acidic pH. So you have to understand that if you're lowering the pH in the mouth very frequently in the day, then bacteria get a longer time duration to rest on your teeth and cause dental decay. The other issue that happens with kids, and is seen in very young kids, especially between the age group of, let's say, between 1 year to 3 years, is something called nursing bottle caries, and which leads to something called rampant caries, which means many cavities and many teeth happening at the same time. This essentially happens because during the soothing period, or when kids are sleeping at night, a lot of parents, moms and dads, and moms mainly, would give a bottle of milk, and that would basically keep the child asleep, and whenever it needs to be fed, would feed itself. But what we don't realize is that if the kid's suckling onto a milk bottle and you leave it overnight in the mouth, there's a lot of sugar and milk that's pooling in the mouth with sugar, and that gives bacteria a field day to feed on, and then it destroys a lot of teeth. So be very, very careful not to leave bottle filled with milk, especially sugared milk or otherwise, in the night. Feed only when necessary. We always like to have, what we call a normal life, and we like to sometimes indulge into sweet things like ice cream or, chocolates. And what I might say might sound very funny, because we don't practice it all the time, and neither do I. Sometimes after a meal, my kids would tell me, let's go into ice cream parlor and have ice cream. And we do that sometimes. But the thing is, as much as you want to reward your child, and if you want to give them a little bit of a sweet or a candy, try and do it before a meal. Because if your meal has enough fiber content, it's going to cleanse away the sticky carbohydrates that rest on your teeth and cause cavities. Another thing that I hear very commonly with people going to extremes of nutrition and people saying that this is what I do in the morning. I do cleansing with some kind of a juice, and I use spinach and I use avocado, or I use green juice and I use a lot of celery, and I use lemon in my juice with a lot of ginger. And I have to just let you know this. I know some people who are carrying a bottle which is like a liter and they're sipping on it for hours in the morning. And that is one of the worst things that you can do to your teeth. A very rapid and very frequent attack of acid on your teeth is going to lead to a lot of erosion, which you don't want. So if you want to have a citrus drink in the morning, let's say lemon and warm water, take it with a straw and take it in one go, and don't spend a lot of time sipping over it throughout the day. It isn't going to be good for you. Frequent snacking again, a lot of people that I see go on having crisps and they think, oh, it's fine because this one is baked and not fried, but you have to see that they're carbohydrates again. So any sticky carbohydrate in your mouth being frequently consumed can eventually lead to the right environment for bacteria to feed on and cause dental decay or plaque to accumulate, causing gum issues. Another thing that I see is that a lot of people into fitness are taking energy drinks, or they take what we call as energy boosting drinks. And those also have a lot of sugar in them and they're quite acidic. So you need to be very careful how much you're going to drink. Even if you go for a 10K run, it should preferably be just water and not electrolyte solution with a lot of sugar in them, because I see a lot of people who run long distances and who keep drinking these kind of drinks eventually have issues with their teeth. There are issues which are related to environment which can cause tooth issues like fluorosis, could be genetics. You could have a problem of deficiency in enamel, but this is something which is beyond you. If there is a very high fluoride content in water, is beyond you, so you need to be aware about it and make sure that you don't consume fluid from that source. Another issue that we find, especially in the Middle East, that we don't discuss is water fluoridation. And you have to understand and realize that we are drinking bottled water, and most of the bottled water that's being given to us in the Middle East does not have the adequate amount of fluoride, which is being suggested by WHO at about 0.7 ppm, which is parts per million. We don't even get 0.2, which means water fluoridation is very poor. So you could at some point in time start looking at having fluoride applications done to teeth, especially when permanent teeth come out at the dental office. You could even buy some fluoride tablets, which might be available here or overseas, and supplement them in your water. And after the age of 6, another thing that you could do is start using fluoride, high fluoride toothpastes. The other thing that can sometimes affect gum and teeth is prescription medications, especially in old age when you have blood thinners. Sometimes even, when you have a situation where some hormonal imbalances are there, especially in women, there are some medication given to supplement a diet, which can cause some kind of gingivitis or gum disease or periodontitis, which is advanced gum disease. And in order for us to, I've already spoken about how to counter and to, sort of keep our diet in check. But in order for us to do the simplest thing possible that we can to have, have our teeth taken care of is establish a good oral hygiene protocol. Brush twice a day, preferably with a power brush. I haven't brushed with a manual brush in probably the last 7 years. So I'm going to show you why and where power brushes help you better. And floss once a day. If you can't use floss, if you're too lazy, use a water jet or a water flosser or a water pick. The second thing that you can do to yourself, which is going to be advantageous, is to use a good dentifrice or a toothpaste with fluoride in it, especially after the age of 6. Below the age of 6, we tend to tread with caution with how much fluoride we're going to be giving the kids. And of course, one of the things that goes without saying is that you should be visiting a dentist every 6 months and getting a thorough checkup and a clean done. And at least a couple of x-rays or 2 or 3 x-rays done once a year, just to try and see for initial problems that might be happening and before they get too big. When we consider your oral health, you have to understand that it is directly related to life expectancy. Today we have something called oral health care. It is not only to do with, which is called oral medicine. So we don't call it only as oral health care, it's also called oral medicine, which means we are understanding that things like, for example, premature delivery can happen if you have severe periodontitis. I mean, this is something which people don't even realize. Many people don't realize who are diabetics that if you actually reduce the amount of plaque in your mouth and reduce the periodontal problems in your mouth, you can actually reduce your blood sugar level. So if you are going to maintain good oral hygiene, you're generally going to have a good good health status. Missing a lot of teeth, you can't eat fiber, you're going to eat more carbohydrates and soft food, not very good for you. You always need a balanced diet. Smoking too much is going to reduce the amount of blood circulation to the mouth, reduces the ability of the oral cavity to fight dental decay and gum disease. So try and reduce smoking, give it up if you can completely. Let's just talk about an issue like cavities or caries. Caries happens when there's a sugar exposure on which bacteria thrive given a period of time in the mouth. And then eventually teeth start to look something like that, where there are cavities in between the teeth, which make them look quite sad and ugly. We do deal with them and we try to do them in the best possible way so we can make them sort of disappear and not only put in white fillings, but put something into the teeth. Like I've done a case here whereby we put something which matches with the tooth and makes these caries disappear. But there is a solution, but why should we even get there? So with good maintenance, good oral hygiene, one shouldn't get to a situation like that. When it comes to another thing like, when I was talking to you about young age and we were talking about things like, and this is a very common issue now, can you imagine, this is somebody who's 18 years old. There is so much of destruction of tooth structure in the mouth because she is constantly consuming sugar juices, especially apple juice is her favorite, and she was consuming about a liter of Coke a day. Now, I'm sure that a lot of parents would say, wow, that's a lot, but it has happened, and it happens to a number of kids because their parents feel if not soft drinks or fizzy drinks, they don't mind their kids having a lot of fruit juices, and eventually it leads to a lot of acid attack and acid erosion. Eventually, this girl came to me and we were able to give her a design of what we would like to do in her teeth. And we moved her teeth from there, protected them with very thin shell of ceramic to make them stronger and healthier. And eventually we changed the way she was smiling. She had very low self-esteem when she came to me, and she completely changed as a person after that. The idea is not to get to those veneers and make her have, I do that if I have to. I will strengthen the teeth, I will make them stronger, but the idea is not to get there in the first place. And well, of course, if you are going to be having multiple issues, and I'm going to try and cover all of them in one go, like gum recession, which is seen quite commonly now. If it is erosion, erosion and abrasion, which means a lot of wear of teeth, like you can see here, somebody who smoked a lot, was grinding their teeth a lot, and eventually was brushing very hard, led to a lot of gum recession, breakdown of teeth, gum disease, and then I had to reconstruct and rebuild the whole mouth, which I did, and eventually got him a smile that he deserved back and eventually good health. He's been maintaining ever since. He actually almost quit smoking, which was great. But the fact is that we shouldn't be getting there. At somebody at 45 shouldn't get there, if at all we can avoid that to happen. So what I would like to recommend to you is, apart from seeing the dentist twice a year and having, a hygiene done, one of the things that you can do for yourself very easily is to use a toothpaste like the one that I use, which is an OralBio toothpaste, which I will mention to you. And what we've seen is that this toothpaste in particular has what we call as stabilized stannous fluoride. It's a fluoride, but it's a stannous fluoride, and it's stabilized in its formula. What it does is it basically gives you it gives you an advantage over other toothpaste by reducing the amount of plaque and calculus or tartar deposit. What also happens that they found in research is that when you use a toothpaste like this, what you're also achieving is a less pH, which means, sorry, a higher pH and less acidic content of the plaque, which is beneficial because then you don't have so much of caries or gum disease. It is also something that we recommend to our clients in case they've had recession and they have hypersensitivity in the exposed dentine, because the stannous fluoride goes, and I will show you in the next slide, and it plugs what we call the dentinal tubules or areas of hypersensitivity. And as long as you're using these toothpaste, you will probably be a little bit far away from sensitivity in general. It also prevents excessive amount of tooth wear by infusing fluoride in the teeth and making them a bit stronger. So as you can see here, enamel repair from Oral-B has stannous fluoride in it, which eventually plugs. In the second picture that you can see, there are holes which get plugged by the toothpaste like this and the fluoride in it, which reduces the sensitivity happening to the nerve. And the other thing that cannot recommend more, which I recommend to my clients every single day, is to use a power brush. Many advantages. Very small head, so you can go to all the surfaces of all the teeth and brush them properly. Big brushes don't allow you to do that. They have timers in them, so they tell you how much time to brush. But what we've also realized, and I was a part of a consensus team twice, thanks to Oral-B and taking me on the program to have my research done in an independent way, we realized that oscillating and rotating brushes are better than any other form of power brushes. So as long as they're rotating and they're oscillating and they're a small head, they will function well for you. We generally advise our patients to use a soft brush. There are many, many researches that are available which will tell you that compared to manual brushes, the efficacy of power brushes is far better. I haven't used a manual brush, I think, in the last 8-9 years. And this is a new brush that I've been using every single day. It's called OralBio. It comes in different series, 7 and 9. And one of the best things that I find is compliance. This is the problem that we mostly have. Clients and patients don't end up brushing 2 minutes per session. But what this does is it basically has a smiley, and I never want to make him sad. And the smiley will smile at you once you brush for 2 minutes. And it's sad, like you can see on the left, if you haven't brushed adequately. Also, you have an artificial intelligence application that you can download, and it basically moves around you have what we call as artificial intelligence built into your brush. So in different zones of the mouth, as you move your brush, it keeps documenting where you're brushing more and where you're brushing less. So over a period of time, you can actually, with these tracking zones, have more effective way of brushing. So it teaches you by itself how to brush better. One of the most magical things that I find is the pressure sensor. So when you put pressure on the brush and if the light's beeping green, you are adequately brushing your teeth. If it beeps red, stop, 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 because then you're going to cause the gum recession to happen, because then you're brushing too hard, which most of us are. We always rushed for time, and we always pressed for time, sorry, and we're always rushing. We end up brushing too hard, which isn't what we should be doing. So try and brush at the right amount of pressure, not too less, not too much. So if it's white, it's too less. If it's green, you're good to go, which means the pressure is good. But if it's beeping red, you need to stop and have less pressure on your teeth. So overall, why would I recommend the OralBio is because I like the design. It's a very enjoyable experience because it uses magnetic sort of rotation in them. They don't have any motors, so it's very, very pleasant on the hand. As I said to you, it uses oscillation and rotation, which is really, really the most effective way of brushing that I know of today. You have a travel charger. These are just add-ons, but the most important thing for me is that it has a pressure sensor, and it is a rotating and oscillating brush, which works really well in my favor and should work in yours too. And I recommend it to every client that I have. I would like to thank you for your time. I hope that I've given you something which is useful. Just to conclude, I would say that Oral-B has been kind enough to offer a 15% off on Noon. You can scan the QR code. We are available at New York Dental Clinic, www.nydcdubai.com, for any of your dental needs that you might have, and more than happy to see you in our office. Thank you very much once again.
Thank you, Dr. AJ. This was a fantastic session. I personally learned a lot. I'm seeing now a few questions. They've been coming thick and fast, but I want to remind everyone that they can send their questions in the chat box. We have maybe around 10 minutes to take a few questions before I move on and pick up some of the questions. I'm going to leave maybe a minute or two for you to send them over. But yes, I want to thank again Dr. AJ and
It's a pleasure.
OralBio for offering 15% off for anyone in the UAE by scanning this QR code. You will just simply register and you get a discount code where you can use at noon for power brushes and refills. For outside of the UAE, please note the email address on the bottom of the screen where you can drop an email and it will be delivered to you at home. Now, after the session, we will be sharing with you the specifics of this discount over email, along with the recording of the session. One thing that maybe I liked in particular, I'm one of the people who I go to my dentist twice a year for the regular cleaning of the regular checkup. But one of the things that really has been impressive to me for the past couple of years is how technology is now there to make our brushing easier, make it more efficient, and also making it fun in the process. I'm going to start now with the first question. We've had a few around maybe liquids in general, and I think this goes back to the slide where we're talking about carbonated drinks. Does drinking with a straw a good way to avoid dental cavities?
It's not so much only about dental cavities because dental cavities happen after a certain amount of erosion has happened. But yes, if you are going to have a fizzy drink, and I do that sometimes as human as we are, if you consume it with a straw and don't keep putting it into the mouth and keeping it for a long duration of time is really, really helpful. So if you were to drink with a straw, you'll have much, much less damage than you were to have otherwise. So taking small little sips versus drinking with a straw is much worse. So yes, a straw can help.
Is drinking carbonated drinks that are sugar-free, will it help me?
No. So, the thing is, what basically is happening when you take carbonated drinks? With a Coca-Cola, you can actually clean your sink. The point is that you are lowering the oral pH to 1.7. So when you take something which is so acidic in your mouth, it is not only sugar with the water in it or with the liquid. It is also what environment you're creating for the bacteria that exist in the mouth to act on. So if you keep creating an environment which is very acidic and you keep continuing to create that environment, it just gives enough time for bacteria to do what they have to do. Yes, probably a little bit less when you are not exposing them to real sugar, but you are still creating an environment which is quite happy days for bacteria to thrive on and create cavities. So you're still going to have a lot of problems. You're still going to have erosion. You can't take that away.
What is the best kind or brand of water that I can drink that has sufficient fluoride content?
I had done a bit of research over the years, and I think Nestle has a little bit like zero point 0.2 ppm. And I found that there was a water company, and I'm not too sure if they still exist or not, which was called Zulal as a water company, which used to provide fluoride in it. If you are going to drink any fluoride, any mineral water from natural sources, you might get them from Turkey or France or whatever. If you're one of those consumers, you still might be able to get enough amount of fluoride. But everybody's not drinking Evian or Fiji water. It's far too expensive for everyday consumption for everyone. So what I do suggest is that after the age of 6, if you go on to having, about at least 1,000 or 1,100 ppm of fluoride in your toothpaste, even as a child, but use a pea-size toothpaste, not very long ribbons, just a pea size. Ribbons are shown by advertising companies to sell more toothpaste. You don't need that. You just need a small little pea-size toothpaste. And if you're using fluoride toothpaste and you're brushing for 2 minutes and let it go onto the teeth, you will have some protection with enough fluoride being taken up by the teeth. And the second thing is after the age of 6, what I would recommend in this country is to go to a dental office once your kids are going for a regular checkup every 6 months, and either with the hygienist or the dentist, they can use what is called as fluoride gels. They can just put them into trays, put them in the mouth for a few minutes, and that's a very high fluoride exposure, and that's the best chance that your teeth can get in this country.
Fantastic. Though challenging and maybe a revelation for many of us, including myself. Another question from Said, which is actually quite interesting. I have a daughter around 5 years old. Is it recommended to have her visit a dentist for follow-up and checkup? I am not seeing any complaints for her as of now.
You know, one of the things, so there are two aspects of going to the dentist. One of them is we don't see problems till they are too late. So because I am a layperson in many other things in my life, I don't realize them till a specialist takes a look at them. One of the things that we understand is that the oral environment is an open environment, which means we can eventually we consume millions of bacteria every day in one way or the other. We are inhaling them as we speak. We are ingesting them as we speak. So once the children are born and they are having their teeth coming into their mouth, which is 6 months to a year, I would say, until about maybe a year or so, the initial visits might be to a dental office, not because you have problems per se, but just because you're monitoring that you might not have problems, A. And B, when you bring children in a friendly environment, when they have no problems at all to a dentist, it gives them a pleasant experience, which is very good for their psyche. Now imagine you're a kid of a 5-year-old who has a very deep cavity, and you take him to the dentist with pain and he has to inject your child. God forbid. If that is to happen, eventually she will have the most traumatic experience of her life and will never go back to a dentist. Now, if you were bringing this kid ever since the age of 3, once a year at least to the dentist, and she was coming, having her teeth checked up and playing around, if she really needed somebody, she'll be ready for it. So it is both. It is a physical requirement and also a mental issue. So I always suggest bring your child in, let them play at the dental office, just make them familiar with the environment, at least for them not to have this trauma or this psychological barrier against getting themselves treated, because the oral cavity is an open cavity. We can fix things if they go wrong. If this was the same thing with your heart or your liver and we could take it out in a box, clean it and put it back, everybody would be doing that service. All over Alkus, we would have heart cleaning centers like auto care centers. We don't have them because we can't open them. But we are very privileged to work in an environment where we can take care of things. So the sooner you start, the better it is.
Fantastic. Question from Tatiana. Why do young kids should not use toothpaste with fluoride?
It isn't got to do anything in particular with the fact that they can't digest or something. The essential thing is that when you're very small, and we're always looking at any kind of drug formulation with weight of a child, we just don't give it to them to use essentially because we don't want them to ingest a lot of toothpaste. I've had my daughter sit in on dining table and put her hands into yogurt and try and put it all over her face. So when kids find a squirty toothpaste nice and if it's tasty, they might just keep eating on it. And then if they eat a whole tube, you might have a lot of fluoride in their body. So we don't want them to have something which is, or we don't want to give them something in their hands which has fluoride content in it. So if the kids are given their toothpaste which has very low fluoride or almost no fluoride, there is never a chance or any, let's say, danger of them ingesting a chemical which might not be good for them at that age.
Another question on children. I'm glad that we're having actually a lot of interest in this part. So, can 12-year-olds use the gum and enamel repair toothpaste too?
Absolutely. Anybody after 6. My kids use it. My son's been using it since, he's been using a fluoride toothpaste ever since he was 6, 7, I think. They used to use children's toothpaste before that, but then after that, I switched them on to a regular toothpaste.
We have room for one more question. Actually, two questions. We have maybe 1 minute, so maybe we can take 2 questions quickly. So, is there an alternative to flossing? I believe maybe we covered that maybe a few slides back, but maybe if we can cover it once more.
There are a couple of things. Some people don't like the big floss thread, so they can use flossets, which are like toothpicks with floss in them, which go click, click, click. and they're generally quite easy to use. And the other thing that I find that I use every day, which I find very, very useful, is to use a water pick. It's like a water flosser. It's available from Oral-B and many other companies, but you could just buy something online, put water in a small container, which is coming with the machine, and squirt water, which flows out at a very high pressure. And eventually it will do maybe not 100%, but quite a good job of cleaning between the teeth. I use it every day, so I would recommend you can use what I call a water flosser if you can't use the regular floss. And
I'll
the other thing
actually have to try today. Yeah, that's
and the other
very
thing that
interesting
I
to know.
would suggest with children was that another thing that you can do to make sure that they don't ingest too much of toothpaste that might not be good for them is that they can have what we call as kids power brushes. Kids power brushes are, as soon as a kid can hold a ball, catch a ball, they can hold a toothpaste and use it, or a toothbrush and use it, generally at the age of 4, 5, 3 maybe, depending on manual dexterity. But the good thing also is that they will not take out a lot of toothpaste. How much can you fill on a small brush versus a long brush? So if you have a very small brush and that's the only thing they need to cover, they will use a lot less amount of toothpaste. That's all that's needed, a small pea size.
For our last question, is there any way to repair damaged enamel?
You can try to revive enamel damage in the very initial stages by giving some high fluoride supplements. There are also some new products in the market which are called resin infusion products, which means if you have some decalcified enamel, you can actually, by a small process, infuse some resin into that enamel and try and re-strengthen it. But this is if it is caught very, very early. If you have an established enamel breach, and if you have a problem which is leading to the second layer of the tooth, which is called dentine, then you can only fix it by having the cavity filled up.
Fantastic. Once more, thank you so much, Dr. AJ, and thank you for everyone
It's a pleasure.
who
Thank you
took
for having me
the
on.
time.
And if there are any queries, please write to us or visit us, and we'll be happy to help you.
Absolutely, and we'll be sharing the details for Dr. AJ's clinic as well as a discount code with the recording that you should be receiving in the next few days. Thanks again and have
Thank
a
you once
wonderful
again, Amy.
afternoon.
Have a lovely day,
Yeah,
one and all. Take
thank
care.
you.
All the best.
Bye.
Bye-bye.